Welcome to VHSO Cares, a program brought to you by the veterans and staff of the Veterans Healthcare Systems of the Ozarks. I'm Laura Mortensen. I'm the Veterans Health Education Coordinator, and I'm your host. Today we're going to talk about hepatitis C, which is a very interesting topic, and with us we have Jennifer Stark, who is the pharmacist for the hepatitis C program. Thank you, Jennifer, for being here.
Thanks so much for having me.
So I think maybe we just kind of talk about a background of hepatitis C and what's going on with our veteran population.
Sure. Well, this is National Hepatitis Awareness Month, May is. May 19th is National Hepatitis Testing Day. The veteran population actually has a higher amount of patients with hepatitis C compared to the rest of the U.S. population. We have over 3 million patients in the U.S. with hepatitis C, and a large portion of those patients actually are born between 1945 and 1965. A lot of times they're called baby boomers, or sometimes called the birth cohort for hepatitis C. 75% of patients of that 3.2 million patients in the U.S. who have hepatitis C infection actually were born between 1945 and 1965. The bad thing with hepatitis C is that a lot of times patients do not have symptoms, and so they may not even know that they have the infection. It's very important that they get tested, and this is a simple blood test that can tell them if they have the infection or not.
So tell me more about May being Hepatitis C Awareness Month. What all is going on with that program?
Well, the excellent thing with hepatitis C right now is that we have really good treatments available, especially through the VA. These treatments can be a single pill that a patient takes for 8 to 12 weeks for most patients. They're very effective and they're very well tolerated. Patients who've been treated in the past, 10 years ago even, not that long ago, the treatments were very hard to tolerate. They were harsh. They lasted for up to a year, and they didn't work very well. Now we have very good treatments available, and they're very well tolerated. So it doesn't matter if a patient's been treated before and had the virus come back. They can receive treatment now.
Okay. So you mentioned that someone may not have symptoms, but they should still be tested if they were born between 1945 and 1965.
Yes, the CDC started recommending back in 2012 that these patients, regardless of any other risk factor that they may have, should be tested at least one time for hepatitis C. It's not exactly understood all the reasons why patients born in that time period have that high risk, but a couple of reasons could be we weren't able to test blood until 1992. For hepatitis C. So anyone who had a blood transfusion before then would be at risk. We also didn't have universal precautions until the 90s about. So patients growing up in the 60s, 70s, and 80s, that's really the high point of hepatitis C infection.
So are there any extra charges for veterans who are wanting to be tested for hepatitis C and treated?
No. The veterans that are enrolled in the VA system can receive hepatitis C care with the normal cost of their medication. So if a patient has a copay, the treatment would be that same typical copay that they would expect. I know that the new hepatitis C treatments have gotten the reputation, and rightly so, for being very, very costly. But the VA has made it a high priority to treat these patients, and there's no additional cost for receiving the treatment.
So what recommendations do you have for veterans who are watching this and thinking maybe they need to be treated? What's the first step they should take?
Talk to your primary care physician at your VA. Ask either to be tested if you've never been tested, or if you already know that you have hepatitis C, you can contact your primary care physician, of course, or you can contact our hepatitis clinic directly, and we can fit you in very quickly to be seen and start treatment.
So share with us a little information about hepatitis C.
Well, hepatitis C is a virus that infects the liver. If you took 100 patients who were exposed to hepatitis C, around 85 of those patients would end up with a chronic infection that does not go away unless it's treated. Of those 85 patients that end up with the chronic infection, their liver can be affected and they can develop chronic liver disease in 2 out of 3 patients. And then in another small portion of those, they can end up with cirrhosis, which is liver failure from scarring of the liver, and even liver cancer. Unfortunately, hepatitis C is the leading cause of liver failure and liver transplants and liver cancer in the U.S. now.
And you said the treatment's easy and
Yes.
the diagnosis is easy.
Yes, this is the best time ever to be treated for hepatitis C. It's a great time to be able to offer treatment to veterans who, like I said, are disproportionately affected by hepatitis C. So as I said, treatment is very well tolerated. The most common side effect is a mild headache. Some people may feel a little run down the first week or so of treatment, but the majority of people frequently come in and have no side effects to report. One thing important to note, and we've talked about it a little bit, is that hepatitis C is sort of a silent disease. It could be affecting your liver and you may not feel symptoms from it. The most common symptom of hepatitis C is just a vague feeling of fatigue. So that's so subtle that a lot of patients may attribute it to something else or not even notice it because it happens very slowly over time. So the liver could be affected and be very, very sick before a patient actually has true symptoms that they would notice that would take them to the doctor. So a simple blood test to identify if they have a chronic infection with hepatitis C can be very important and even life-saving.
How long does treatment last? You said that they take pills.
Yes, it can be as short as 8 weeks. It could be as long as 24 weeks. That's in very select cases in patients who've failed many treatments before, who maybe have cirrhosis. But other patients, especially younger patients with a low viral load who've never been treated, could be treated as short as 8 weeks. The majority of patients end up with a treatment for about 12 weeks.
So we've been discussing hepatitis C and the treatment available now at the VA. At the end of this program, we will show the contact information for Jennifer, but the recommendations were to contact your primary care team if you have questions about treatment and feel that you fall in this group that maybe should be followed up. Anything else you want to add?
No, I really appreciate you having me here today. Thank you.
Thank you, Jennifer, for being here, and thank you for watching. Please contact us if you have any questions, and VHSO cares. Thank you.
Thank you.